Welcome to NCLEX Map, your go-to place for mastering clinical judgment the smarter way. We've covered some essential topics so far: management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, basic care and comfort, and pharmacological and parenteral therapies. Now, let's dive into number 7, reduction of risk potential, which is crucial for your NCLEX RN success. This domain is all about spotting early signs of complications and taking action before things escalate. Prevention isn't just a nice-to-have, it's the heart of professional nursing. Imagine it's 7 a.m. on a post-surgical step-down unit, and you're starting your shift with 4 patients. The night nurse finishes report with a knowing smile, saying, "2 of them look fine on paper, but something feels off." You nod, feeling that intuition kick in where the numbers stop. Your first patient, Mr. Allen, is 3 days post-abdominal surgery and seems eager to go home. But his urine output has dropped sharply overnight, raising a red flag for you. You remember that declining output can signal early fluid deficit or renal strain. You assess, verify IV patency, review labs, and call for evaluation before things get worse. A fluid order is adjusted and balance is restored. No drama, just quiet prevention through awareness. Next, you check on Ms. Rivera, recovering from thyroid surgery, who greets you cheerfully. But her voice sounds faintly hoarse, and you notice a subtle muscle twitch near her mouth. You recognize these as early signs of low calcium after parathyroid irritation. A quick focused check confirms your suspicion, and you notify the provider. Calcium replacement is prescribed, and potential complications are averted. What started as a smile and a small twitch could have escalated, but your vigilance turned it into safety. Moments later, a monitor alert from Mr. Jensen's room catches your attention. He recently had a cardiac catheterization and says, "My leg feels different." You check pulses, warmth, and color. One leg is cooler than the other. No visible bleeding, but perfusion is reduced, so you act quickly. You position the leg correctly, document, and contact the team. Early recognition prevents circulation loss and long-term harm. Later, Mrs. Young, preparing for discharge after IV antibiotics, mentions feeling lightheaded. You stop and assess the IV site, noticing mild swelling and redness. Early infiltration. You stop the line, elevate her arm, and apply gentle warmth, preventing further issues. As your shift ends, you look around and see no emergencies, no code calls, just safety maintained through steady observation. Reflecting on the day, you realize 4 patients, 4 potential complications, 0 adverse outcomes. This is what reduction of risk potential looks like in action. It's the nurse who notices a quiet change in output, hears a different tone in a patient's voice, and catches a pulse before it disappears. These aren't lucky saves. They're the results of critical thinking and calm presence. Nursing excellence isn't always about dramatic rescues. It's about knowing that prevention is the highest form of care. Every shift, every chart, every subtle cue matters, because protecting patients before harm occurs is true clinical mastery. Thank you for learning with NCLEX Map, where we turn knowledge into confident decision-making. If this scenario helped you think like an RN, like, subscribe, and share it with your classmates. Your engagement keeps these lessons coming. One domain, one skill, one story at a time. Stay curious, stay compassionate, and always think one step ahead. See you in the next video, where we explore physiological adaptation, the final and most critical section of the NCLEX RN test plan.